Go for it.
Good evening again. So I'm Ashley Apple, Virginia Nurses Association. I'm a nurse practitioner and a professor of nursing. 27 states and DC have full practice authority, which by definition means that they are regulated solely under the Board of Nursing and there is independent practice. They're all doing just fine. There's no evidence that a joint board provides any benefit to the public. In fact, it actually may do harm. The Federal Trade Commission warns that when states allow regulatory oversight by physicians, they, quote, effectively give one group of healthcare professionals the ability to restrict access to the market by another competing group. And to be clear, the market in this case determines access to healthcare. The FTC calls it anti-competitive, citing the risk of physician bias due to professional and financial self-interest. These competitive costs should not be imposed on the public without compelling evidence of benefit to health, safety, or consumer protections, and in this case, there is none. There are 2.6 million Virginians living in a health professional shortage area, but we keep losing nurse practitioners when they graduate from school, because why would they stay here under the regulatory thumb of physicians and a long transition of practice period when they can scoot up to Maryland, who's had full practice authority for a decade, or DC, where full practice authority has been in place for 25 years, and they can practice starting independently from the time of licensure. So out of concern for public health, we ask you to help us make the practice environment better in Virginia so that we can keep more of our nurse practitioners and serve the needs of the public. Thank you.
Hey there, we've also met before, but again, my name is Alicia Pack. I'm the president-elect for Virginia Council of Nurse Practitioners. A couple of extra points here is the most important part of the role of nurse practitioner is the word nurse. The Board of Nursing, with the requisite expertise in nurse education, training, and practice, is the entity best suited to regulate NPs, which is the standard in 47 states and the District of 46 states and the District of Columbia. The opposition may say it's about discipline. It's not about discipline because 46 other Board of Nurses who have sole oversight have no problem with this issue. Be reassured, we are not going rogue. In fact, we plan to remain as a collaborative partner in patient health care indefinitely. We are, however, respectfully asking for an equal opportunity to be governed by the only body of professionals who are qualified and knowledgeable in the profession of advanced practice nursing. At a time where Virginia is struggling with access and affordability, we must be wise to make evidence-based decisions that reduce our regulatory burdens and enable our nursing workforce. Passing House Bill 978 is a common sense and cost-efficient legislation, and we ask for your support. Thank you for your time and consideration.
Katie Page, again, representing the advanced practice midwives. Again, I want to state importantly that this bill is not about an APRN compact. There's no language in this bill about joining a compact. This is about modernization and simplifying the regulatory structures for advanced practice nurses and advanced practice midwives, who currently are the only healthcare professionals in the Commonwealth that have no formal representation in regulatory matters or in disciplinary action by the boards that are promulgated to oversee their practice. The document that was a guidance document in 2016 called Collaboration in Team-Based Care that was produced by ACOG as well as 16 other professional organizations representing APRNs, physician assistants, physicians, and midwives stated that, quote, although authority for scope of practice determination and regulation resides with the states, professional healthcare associations have established and should continue to establish and promote standards of care and standards of conduct for their specific professions. States should rely on guidance by professional associations when licensing and regulating healthcare providers, end quote. The most appropriate professionals to establish standards for practice and regulations governing APRNs and advanced practice midwives, including disciplinary action, are APRNs, advanced practice midwives, and their professional organizations, not physicians and not medical associations. So I implore you to pass this bill, which again moves advanced practice nurses under the Board of Nursing and establishes an advisory board for advanced practice midwives. Thank you.
So we have about 45 seconds left.
Madam Chair, members of the subcommittee, my name is Josh Carlson. I come to you as a nurse practitioner as well as a veteran. That being said, I can speak to you about chain of command. In the military, nurse practitioners answer to their own chain of command. Doctors answer to their own chain of command. They all answer to the Surgeon General. So if there's a disciplinary intervention that needs to take place, they answer to their immediate chain of command. There's no crossover there. That happens, I mean, they operate that way in the Tidewater area, they operate that way in Fort Lee and Petersburg, they operate that way in Northern Virginia. So this is a common sense bill to pass. I ask that you support it similar to the way we do.
Madam Chair, Jared Calfee with AARP Virginia. I would just say that there's no scientific evidence that supports one clinical sector regulating another, and emphasize that this unnecessary bureaucracy can mitigate consumers' access to needed healthcare services that APRNs provide. Thank you.
Thank you. Is there anyone here to speak in opposition to the bill before we go online? Please come forward. You have 5 minutes.